Hello, and welcome to the Smart Injury Doctors Podcast, the injury market's top program for doctors, lawyers, and insurers who want to gain greater insight on how to improve patient recovery results and deliver better services in the U.S. injury market. Please welcome your host, Dr. Jeffrey Allen Kronk.
Hello, doctors, and welcome to today's program. What I want to talk about is some general and specific suggestions that you can give to your patients to actually improve their injury recovery. Now, remember, injury recovery, especially in the spinal ligament injury market, is significant because 50% of the patients that actually receive this type of injury are not going to fully recover. And 30% of them are going to have a significant amount of problems associated with that type of an injury. These injuries are not the sexiest injuries in the market, but they're the most common injuries in the market, and they cost the most amount of money. They cause the most amount of personal trauma and trials and tribulations, simply because so many people with these types of injuries get a chronic outcome. They become chronic as a result of these injuries. As a matter of fact, if we have 4 million auto accidents or auto injuries in this country, 2 million people every year are going to be chronic as a result of those injuries. So when you are dealing with patients and you want to get better results, I'm not going to get into specifics of adjusting if you're a chiropractor or what type of modality you're going to use or anything else. I'm going to start with some very, very general tips for you. In the Smart Injury Doctors program, we call these Smart Injury Recommendations. And they're just some very, very general recommendations. Now, we know that when a person has a spinal ligament injury, again, they need to take this injury really, really serious. And so how you come across to that patient, your level of professionalism, your level of certainty, your level of handling the patient is how they will respond to what you're actually telling them to do. So if you're not making this condition significant, and we train doctors, look, a lot of ligament injury patients, spinal ligament injury patients have serious spinal ligament injuries that lead to serious spinal instabilities. That condition can cause them problems. It's a fairly permanent condition. It's going to cause them to have a unstable segment or segments for a long time to come. So they need to take their initial treatment very seriously, because that's where you're going to try to reduce down their risk for long-term residual complaints and get them a great, great result. So let's talk about one of the first things that you should be talking about, and that's dehydration. When your body is not receiving the amount of fluids and the amount of water that it needs, it takes its toll on injury recovery. It slows it down. It makes it so it's not nearly as good. Remember, water is the primary way that oxygen and nutrients get delivered directly to a spinal injury. And dehydration is one of the most common reasons why cell function becomes disrupted, no matter what. So essentially, if you lack fluids, you're going to create a delay, and you're not going to have as good of an injury result. Now, that sounds really simple, doctors, right? You're going to tell the patient to drink water. Right? And you really, Dr. Kronk, I'm going to tell the patient to drink water. Absolutely, you're going to tell the patient to drink water. And what you're going to be shocked is if you start to actually go, how much water you drink, you're going to be shocked to find out how little patients are drinking water. And I'm talking water. I'm not talking about soda. I'm not talking about juice. I'm not talking about vitamin water. I'm talking about pure water, just regular water, good water. So, typically the body fluctuates from anywhere to 60% of its total weight is actually in water. So how much water do you want the person to consume? Well, a good sort of roundabout, hey, this is a good way to start, is half their body weight in ounces of water every single day. And you want to increase their water content. They will improve their injury results if you hydrate them. So they got to get up first thing in the morning. They start to drink water. If they drink coffee, they got to offset that cup of coffee with an extra cup of water. So you want them drinking water. So that's one recommendation that you can use. It's a very general recommendation that basically hits home. Now, you don't just recommend it. You're going to ask about it. Ask about it in your reexaminations. Are you doing this? Especially if you have a patient that's not progressing in a manner that you deem to be appropriate for what you normally see under your care. So let's go to the next thing that you can do. And again, these are all just smart injury recommendations. We have them in our Smart Injury Doctors program. And the next recommendation is the patient has to get proper sleep. Sleep is so misunderstood. But if we look at the course of injuries and how injuries heal successfully, they have to have healthy tissue growth. They have to repair the damaged tissue and now have healthy tissue growth. Well, according to the National Sleep Foundation, the growth and repair of tissue occurs in the third and fourth stages of sleep, which after you've completed about 70% of your rest, that's when those stages happen. So this means that you've got to get an uninterrupted night of sleep. It's crucial. Now, when you tell patients that in order to get better results, they need to sleep more, a lot of patients are going to be, oh my gosh, that would be so great. I wish I could. And you've got to help them. Okay, great. You got to get to bed earlier. Watch less TV. Don't eat so late at night. They've got to jumpstart their immune system. And a healthy and strong immune system is crucial to all types of healing. Without a strong immune system, you can't properly create healthy tissue, fight infections, or stay in the path of a successful recovery. And, part of that path is you got to sleep, or you're going to elongate your healing time. So, you can't be constantly tired. So what's enough sleep? Well, according to Mayo Clinic, this is the optimal level of sleep. For newborns, it's 14 to 7 hours a day. For some, a child that's 12 months old, it's about 10 hours a night plus 4 hours of naps. 2 years old, it's about 10 to 12 hours a night plus 1 to 2 hours of nap. 3 to 5 years old, it's 10 to 13 hours. 6 to 13 years old, 9 to 11 hours. 14 to 17-year-olds is 8 to 10 hours. Adults, 7 to 9 hours. So you got to get at least that amount of sleep. If you have an adult, they need at least 7 to 9 hours a night. If you've got a teenager, they need 8 to 10 hours. That's what they need in order for optimal healing to occur. And remember, optimal healing and the repair of tissue occurs in the later stages of sleep. So they got to get a good night's sleep. So they got to drink more water. They got to get better sleep. These are very general recommendations. Now, the third recommendation that our doctors recommend, and again, this doesn't interfere with your treatment plan. This doesn't interfere with what you're doing clinically or the types of modalities you're using. These are just general recommendations that are going to improve your injury results, is that people need to eat better. They need to eat better. Remember, in an injury, you got an inflammatory response going. So what do you want to do? You want to create a good non-inflammatory diet. You want your diet to include nutrition that is going to be reducing of inflammation. So you got to eat more anti-inflammatory fats. Fats are, the good fats are like fish, salmon, sardines, olive oil, mixed nuts and seeds, avocados, flaxseed oil, fish oil. And you got to stay away from processed foods that are high in saturated fats, vegetable oils like corn, safflower, sunflower, soybean oils, or foods with trans fats. Those are high inflammatory foods, right? And you might also include, so anything that is a leafy green vegetable is highly anti-inflammatory. Anything that's, a vegetable that's grown above the ground is highly anti-inflammatory. And they might also, now this is by no means is a podcast on anti-inflammatory diet or on, a deep dive into sleep or a deep dive into water and hydration. We could take deep dives into each one of these areas. This is just 3 common, simple things that you can include in your recommendations. So, there's spices that are anti-inflammatory like bromelain from pineapple, garlic, curcumin, turmeric, curry powder, cocoa, tea, and berries. Those things are, they provide anti-inflammatory substance, and they also provide a lot of nutrients. They're nutrient dense, and that's what the body needs when it's going to repair. So it's very easy to just talk to the patient about better sleep, better hydration, and better diet, at least while they're actually going through your treatment program. Now, if they adopt these habits, you've created a healthier patient. You've created a much healthier patient. And that's one of the keys. That's one of the things that as an injury provider can significantly help and influence a person to become healthier. And now they can also look at long-term things that keep their health, such as ongoing care, supportive care in your clinic. If you have a spine's like the teeth. If you don't maintain it, you're not going to get as much. You're not going to get as much mileage out of it. So people have to take their spinal health very seriously, and you as an injury provider can seriously influence that. So that's what I wanted to talk today about, was just opening it up to, hey, here's 3 simple recommendations. Again, in the Smart Injury Doctors program, we call these Smart Injury Recommendations. There's other recommendations that you can give the patient to get better outcomes. But these are 3 simple things that you want to go over with the patient that will improve your injury results. Like all of these podcasts, I take just a short topic and we discuss it for 8 to 12, 13 minutes so that you can listen to the topic on your way to work. If you've got an Echo Plus at home, you just holler at Alexa to listen to the Smart Injury Doctors program. But these are just key tips that will help you get better results with your patients in the injury market. As always, if you are struggling with something in the injury market, put it down below in the comments. Tell me what you're struggling with. Tell me what you have a problem with in the injury market. Tell me what you'd like to focus and be able to do better on. I pay attention to your comments, and I seriously appreciate them. Doctors, thank you very much for your time, and I look forward to seeing you on the next podcast. Thank you.
You've been listening to the Smart Injury Doctors Podcast, the #1 audio production show for professionals in the U.S. injury market that want to deliver better injury services to the patients, clients, or insureds they serve. If you like what you heard today, please leave us a review and don't forget to join us on our next program.